If you've ever had SI joint inflammation or SI joint dysfunction, you know this can be a really painful condition. So what is the SI joint? It's this joint right here between the lower part of your spine where your tailbone is and your hip. This joint helps stabilize your spine and your pelvis. Patients who come to see me with SI joint inflammation or irritation usually complain of pain in their lower buttock that's aching and sharp. It can radiate down their leg or radiate into their groin. Sometimes it can even feel like sciatica. Many times the pain can be worse if you're bending, twisting, or walking upstairs. Sometimes even crossing your legs to tie your shoes can be painful. Patients at high risk for SI joint dysfunction usually have a joint that's moving too much or it's not moving enough. Inflammatory conditions like rheumatoid arthritis or ankylosing spondylitis can make you high risk for SI joint irritation. Hypermobile conditions like pregnancy when women's ligaments are more lax, or Ehlers-Danlos syndrome where you have chronic joint laxity can make you high risk to have SI joint irritation. And then hypomobile conditions like osteoarthritis, a previous spinal fusion, or scoliosis where there's a leg length discrepancy can make you high risk to get SI joint irritation because the joint can't move the way it's supposed to. When I diagnose patients with this condition, usually we start with conservative things like physical therapy, anti-inflammatories, heat and ice. Sometimes massage or dry needling can be helpful. If patients don't respond to those types of therapies, then sometimes I'll try an SI joint injection, which is where I use an x-ray machine to guide steroid into the joint, similar to what we do with knees and hips. And sometimes I'll prescribe an SI joint belt, which helps stabilize the joint. Once a patient has SI dysfunction or inflammation once, it can come back again. So I try to focus on helping patients find a good treatment strategy that they can do at home to try to get the pain under control as quickly as possible. So let me know if you have any questions in the comments, or let me know what helps your SI joint irritation.